early stages of multiple myeloma, you may not have any symptoms at all. You may have received your diagnosis when you were having a routine physical exam or blood tests while being evaluated for another condition. However, there are a number of symptoms that may arise as multiple myeloma progresses, and you may experience some or all of these. The most frequently reported symptoms are bone pain, fatigue from anemia or excessive levels of calcium in your blood, constipation, nausea and vomiting, and frequent infections. Most of these symptoms are treatable. It is important that you feel comfortable discussing all of your symptoms with your doctor or other members of your treatment team. If a symptom is significant to you, it is important to them. To help you understand why these symptoms occur, it's important to explain that myeloma cells grow rapidly in the bones, and this can cause bone pain and the destruction of your bone. More than 2/3 of patients report having bone pain when they're diagnosed. Unfortunately, about 80% of all patients with multiple myeloma will develop skeletal abnormalities during the course of their disease. The bone destruction may result in osteoporosis, which makes bones fragile and more likely to break. In fact, multiple myeloma is often diagnosed after a broken bone. Your bones contain calcium, which is necessary to keep them strong. However, multiple myeloma causes your bones to break down faster than they're able to rebuild, resulting in increased release of calcium into the bloodstream. This calcium can then lead to a condition called hypercalcemia, or high levels of calcium in your blood. The symptoms of hypercalcemia include tiredness, frequent urination, disorientation and difficulty thinking, constipation, nausea, muscle weakness, and vomiting. Hypercalcemia is found in 15 to 30% of patients at the time of diagnosis with multiple myeloma, and about 30 to 40% of patients will have hypercalcemia at some point during the course of their disease. Excessive levels of calcium are not good for your body. The condition can lead to heartbeat irregularities and cause your kidneys to function poorly or even shut down. Your doctor will be keeping an eye on your calcium levels, and you can discuss treatment options if your levels become too high. Kidney problems are seen in about 30% of patients at the time of diagnosis with multiple myeloma, and more will experience kidney problems as their disease progresses. M proteins released by the myeloma cells can enter the kidney and cause the tubes that filter the blood to become damaged. Many chronic diseases and cancers increase your risk of anemia, and multiple myeloma is no exception. Anemia is a condition in which you do not have enough healthy red blood cells to deliver oxygen to your body, and this may make you feel weak. Like plasma cells, red blood cells begin their growth and development in the bone marrow. These red blood cells contain hemoglobin, which carries oxygen to your tissues. A decrease in red blood cells means a decrease in hemoglobin, and therefore a decrease in oxygen circulating throughout your body. This can lead to fatigue, dizziness, weakness, and shortness of breath. Be sure to tell your doctor about any of these symptoms, because you can work together to help reduce them. As a result of myeloma damage, the bone marrow produces fewer white blood cells. Because white blood cells are necessary for fighting infection, patients with multiple myeloma are more prone to getting infections and may take longer to recover from them. Your doctor will keep a careful eye out for bacterial pneumonia in particular, which is the most frequent type of infection found in multiple myeloma patients. Other medical issues that may affect patients with multiple myeloma are low platelet counts and excessive M protein levels in the blood. Low platelet counts increase the risk of bleeding, and excessive M protein levels in the blood can cause the blood to thicken and may result in damage to organs of your body.